Hello, everyone. So we are going to talk about e-consent, and we're going to do this. We felt like there was pieces to this e-consent module that we wanted to talk about, so that's what we're going to do today. And I have a team here. My name is Brenda Hudson. I'm the Director of Recruitment Services for the Indiana CTSI and Associate Director for All In for Health, which is our engagement mechanism for recruiting people into research studies. I have with me Chris Caldwell, who's our regulatory person for Indiana CTSI. I have Alexander, who's going to be talking about how to develop e-consent, and I have Fatma, who is she's our user. So feel free we're going to leave a portion, about 15 minutes or so at the end, to answer questions about e-consent. There was a lot of different things that people were looking for. Excuse that, sorry, in here. And so we just wanted to make sure we touched on each one of those key points. So what we're going to talk about today is what is e-consent. We're going to kind of walk through a little bit of designing your e-consent framework and setting that up. And then we'll talk also about 21 CFR Part 11 compliance, just real briefly to kind of tell you what that is. You saw Paul mention that briefly about what it takes. It takes a lot of work, just so you know, to make that happen. And then also I'm going to talk about design of your e-consent to make it more user-friendly. What is e-consent? It's basically just an electronic consent. It's a method for obtaining research information through a digital platform, right? So you guys usually have a paper consent, you have people sign. Paul was talking about when it was great during COVID because we did, in case you didn't know, a vaccine study here. Couldn't consent people through that because it wasn't 21 CFR Part 11, but we were able to kind of do a couple other projects through it for COVID that we actually used the e-consent platform, and it was amazing and it really worked well. And we even did it where we recruited whole families and had them all sign multiple consents. So it's come a long way since we were doing that. So it's very exciting, I think. And you can do this at site or so you can have basically an iPad and do this, or you can do it at home. You can send people the consent and have them fill it out. We'll talk a little bit about how you should look at that when they do that to make sure that it's all completed correctly. But the goal is to improve your participant understanding. So you just don't want to take your paper consent, throw it up there and have a signature part where people can sign it. That's not really helpful. And I don't think it really helps the consent process. So you want to think about your design of your consent from an electronic standpoint while you're doing this, not just that I need to get a signature on something. So Alexander is going to come up and talk about just how to kind of get you started and get your design.
Thanks, Brenda. Thank you all again for being here. So my segment is going to be from the standpoint of a REDCap admin. I'm describing some of the basic features. That sound good? All right. So as Brenda mentioned, REDCap has this e-consent framework to provide e-consent digitally. The framework can be used to obtain electronic signatures for non-FDA regulated studies. And just to note the qualification there, REDCap itself is capable of 21 CFR Part 11 validation and compliance, as Dr. Harris alluded to, but it's IU REDCap, our particular instance, that hasn't yet gone through that validation process. Consent forms can be implemented in a REDCap survey via your computer, whatever kind of computer device, mobile phone or tablet. And you're going to want to make sure to list in your IRB application that you will be using REDCap to capture consent. You only have to show the IRB the final consent language, not necessarily exactly how it looks in REDCap. And significantly, images or videos will need to be reviewed and approved. So there's been recently, just in the past year, as again, Dr. Harris alluded to, there's been a redesign of a lot of the e-consent framework functionality in REDCap. It's really an e-consent 2.0 in REDCap. And so there, yeah, so it's no longer actually called the PDF auto archiver, but there's basically two separate steps to the REDCap eConsent framework, two different things that it's providing. Number one, before the participant completes the survey, there's going to be an extra certification page that includes an inline PDF image of the responses. So the participant is going to be prompted to scroll through that PDF image and verify that it represents their responses accurately and comprehensively. And only once they confirm that all of that is correct, only once they check the box for verification, then they'll be able to submit that consent survey as complete. And so the second thing that the eConsent framework is adding is that a static copy of their responses, exactly as they viewed it, exactly as they scrolled through it, exactly as they verified it, is going to be added to the file repository for that project. And that'll be time-stamped and have some information about the submission of the consent. So why a framework? Why do we call it an eConsent framework? It's because enabling this option alone doesn't provide a whole eConsent process, but just gives you the general framework or mechanism to allow you to provide the eConsent to participants. So as a survey admin, you still need to create your eConsent survey. So you have to set it up appropriately, and all of the information that you want to collect needs to be included in there, including a signature. The framework does allow you to implement your eConsent process by providing these standardized tools that we just talked about, while still giving the ability to customize your survey. So the signature process, patients or subjects can sign their consents by typing their name or by utilizing a REDCap signature field, or both. You can also assign PIN numbers to participants to aid in the signature process, but do note that, just to repeat this point really, or to underline it, is that that's not part of the REDCap eConsent framework itself. It's not going to set up the signature process for you. You will want to include that in your survey and make a determination about what the best way is for you to collect signatures. So there are these options about including eConsent versions and custom tags or categories in the consent. And those are text fields that the values will be put at the footer of each page in the PDF. And so you can update that version number or update that custom tag category information as you go along, so that at any given time, as you make updates to the consent form, that's going to be reflected at the footer of the consents as they get saved. So it'll be easy to identify which version is currently being used. And so anytime that you do make a modification to the form, it's going to be recommended that you update the version number to make clear that there's been an update. So this custom tag category, as I mentioned, it's optional. It's just a text label that you might want to put in the PDF footer to signify the type of eConsent that this survey represents. And so you can use that to distinguish between multiple eConsent forms within a project. You can also provide consent forms as an inline PDF or a rich text that will be displayed on the consent survey itself. This is something that's new, that's part of the redesign of the eConsent framework this past year. So you have an option to be able to include these various consent forms They can be context specific. So if you're using the multi-language management module, you can have a version of the consent form. It's actually distinct consent forms for each language that you're using, and also for data access groups, so that you're displaying the correct consent form for a participant for a specific language or assigned to a specific data access group. So that's in, most generally for multi-site studies, where you're working with different groups of participants in this case. So the general design and setup using the framework. On the project setup page, you're going to select to enable use surveys in this project. And again, this is just very introductory walkthrough of what you're going to do to be setting up and accessing the eConsent framework. So you do need to, in the main project settings, at the very beginning of the project setup page, when you first create your project, those are the highest level decisions you're going to make about what functionality you want to be using in your REDCap project. And in fact, the very first one there is to enable the use of surveys in the project. So you do want to do that before anything else. And then in Designer, you can build your eConsent form. You can include name fields, signature fields, a date of birth field. And then you're going to, again, in Designer, enable that consent form as a survey. And then you'll see that there's a button for eConsent under survey options. This is still in Designer. And then you'll be able to select to enable the eConsent framework for that survey. And so this is an image of the current primary and additional settings page for the eConsent framework. When you select to enable a given eConsent framework, and you can have multiple eConsent frameworks within a single project, but these are the different settings that you'll be prompted to include. And you have some settings there, as you can see, for whether or not to allow the eConsent responses to be edited by users, to include name fields, date of birth, etc. Similarly, there's several other optional settings relating to the location of where you want to save the signed consent snapshot. So in the past, it was called PDF Auto Archiver. Some of you may be familiar with that language, whereas now it's going to be referred to as the snapshot, the PDF snapshot. And that's because the PDF snapshot functionality has expanded now beyond the eConsent framework. But it's always automatically going to be saved to the file repository by default, but you now have this option to also save any of these eConsent responses to a particular field. And so that's going to be useful. You can save it to a file upload field so that you can then send that on to the participant or to some other interested party. It's also going to be useful for multi-signature consents, where you're going to collect those on multiple survey pages and then send that as a combined PDF snapshot to participants. As always, you'll want to test all of this out thoroughly before actually making use of it. So this is the eConsent certification page. So you can see this is what a participant is going to see. They've gone and they've filled out the REDCap survey, the consent survey, and then they're going to click to go to the next page or to submit it, and they're going to get this inline PDF image of their responses with this certification page that they'll need to check. I will hand this back to Brenda.
All right, so that was just a brief overview. There is a really good video that was actually done by Catherine that used to be here on how to create eConsent if you want a more in-depth kind of look at that. And Alexander is awesome, so you can always ask questions during office hours or things like that. But now we're going to talk about some of the things to think about beyond just like creating it within REDCap. One thing that I wanted to mention when Alexander was talking about, your information that you put in their signature, if you're doing a combo consent HIPAA authorization, remember that there are key things that you have to collect from the participant from basically law for the state of Indiana. So you're going to collect date of birth. I'm looking at Chris to make sure I'm saying this correctly. Address, along with their signature. So you're going to want their name, their date of birth, and their address. So it doesn't necessarily have to be above the consent or whatever, but you need to make sure that you're collecting that. So did I miss anything, Chris? No. Okay. The other thing too to think about is how you're going to give a copy of that consent to the person. So if you're setting it up and you're going to email them, you're going to want to confirm that the email address is correct. And that I love the new feature where you can change what shows up on the bottom. Before we had to kind of mess with it a little bit because it wasn't as kind of user friendly in that way. And so you want to make sure, like if we were using MRN to have that identification, you wouldn't necessarily want the MRN on the consent that then went to that person. So you had to kind of think about those types of things. So when you're setting yours up, just review those things. Like if it's going to be emailed and it actually gets to the wrong person, what am I sending to that person? So sometimes we will send not necessarily a signed version of the consent to that person, just a copy of the consent, so that if it ends up with someone else, it doesn't necessarily have that person's name on it. Unless it's an FDA study, they don't necessarily need, it's not required that they get, it's good clinical practice that you give them a signed copy of the consent, but it's not required that they get a copy. So if you're going to be emailing it to them, that may be something you want to think about. Is this something that there's a lot of information and that maybe if it got to the wrong email address, is that going to be problematic? So just something to keep in mind. Okay, so best practice design. So my thing is always talking to the public and being very public friendly, participant friendly. So what I'm going to talk about is ways to kind of think about your consent design to make that more user friendly. So here, I'm just talking about some best practice. Now, this is obviously a very simple consent, right? This is not industry trial where you're going to have a lot of information in there. So you're going to want to think, though, this is basic design concepts: more white space, break up your consent, make it simple, use bullet points. Paul was talking about AI features in REDCap, which I love because it may help you with a lot of this. Now you can kind of use, the university uses Copilot, right? You can use ChatGPT. In case you didn't know, the reason why they kind of don't have you use ChatGPT and use Copilot is because when you use ChatGPT, that all kind of goes into the system to kind of help with algorithm. So your information is now being used in that manner. So they prefer that you use it on the internal side, which is in the Copilot. So just a piece of information that you probably didn't know that you wanted to know. So anyway, so, white space, use pictures or illustrations where you can. That helps people as well. You're going to keep it, you'll hear 8th grade reading level. That's what the IRB tries to. We say try to keep it to a 6th grade reading level. The simpler you can make it, the better for people to understand. You got to remember, most people, this is not their space. We work in this space, so it seems more understandable, but it's still not understandable. If you're trying to explain it to your grandmother or your grandfather, would they understand what you're saying? That's how you want to think about it. And then use color formatting to help to make it visually appealing. Now, also you have to think about all the ADA kind of rules around that. So red is always good for a lot of us, but red is not something that you use when you're trying to make something ADA accessible. So just, you want to keep those factors in mind. Best practice on wording, simple language, avoid medical terminology, easier said than done, right? Like there's some things you're like, how am I going to explain this complex medical complex and do it in a manner that people understand. There are some, like Michigan has, NIH has, like how can you take that medical terminology and make it user-friendly? And you can find some of those words to maybe help with this a little bit more. Sometimes when you put it into Copilot, you're like, make this simpler, and it really doesn't. Some of those terms are still, so even though they're AI has come a long way. You still have to vet it and make sure that it's understandable. And sometimes give it to somebody who doesn't do this work and say, read this and tell me what this means to you. That is really helpful because you want to make sure somebody's honest with you, but they'll tell you whether they can understand it or not. Keep paragraph length less than 7 lines. So a lot of times in consents, right, with the old consents, it's like all of this information and it's broken up, right, in each of those key components that the IRB says you have to have, but then it's all in one big clump of a paragraph. Nobody's reading that, just so you know. They're just like, okay. So if you can break that up and make it simpler, I'm going to give you some examples to show you what we did that the IRB allowed us to do. The IRB at IU is wonderful. They are willing to work with you. So talk with someone about like, hey, here's what we want to do. Can this be okay? Here's how we've changed this language that's required to make it more understandable. Usually I find that they're very open and accepting to that. Focus on priority, need to know. Sometimes we're like, we're going to put everything in here. For any of you that have been using All In for Health and your study listings, we'll kind of tell you the same thing. What are the key things they need to know about the study? Don't put everything in there out there because people just get overwhelmed with it. What are the main key things? I am just as bad at this as other people where you're just like, I feel like they need to know all of this. And it's like, sometimes you have to go, do they really need to know this like one little thing? No, probably not. You can tell them that later. So you want to kind of think about that. Like if it's critical to the study, if it's a risk, things like that, yes, obviously. But some things aren't probably as important as we sometimes think they are. Avoid using terms like randomization, right? People don't understand that. You can say flip of the coin, chance, things like that. Spell out abbreviations, use more active than passive, right? What are you going to do? You're going to come in, you're going to do this thing. We're going to draw your blood. We're going to have you sign this document. You're going to complete this questionnaire. Very simple like that. Okay, so this is an example of the Indiana Biobank's assent. I've showed the consent, the main one before, and it's exciting too, but this is their assent. Now this is a paper version, but you could easily, and I'll tell you how I would do this from eConsent version, but see how this is made simpler. It's put in this where they use images. They've made it into a comic book. This is done by Research Jam through the CTSI and kind of took those key components and put in there to kind of explain it, right? And then broke it down and then had your signature line. So if you were doing this in an e-consent way, and think about this like on a phone, right? It could start with, first image, switch to the second image, then to the third, right? And so on until you got to the last part, and then it would have the description. I always like summarizing, again, at the end, what you said that they're going to do. So you wrote all that other stuff, and then you said, here's all the things you're going to do. And then at the very end, just summarize it. So in summarization, right? I probably wouldn't use summarization, but here's what you're going to do. 1, 2, 3, 4, 5, right? Here's what's going to happen. And so this kind of reminds people as they're kind of glossing through, think about how you do when you do forms, when they get to the end, that they're just kind of focusing on those last couple components. I had Alexander add this in here because I think this is amazing. We've been talking about this for a while, but now there's this ability to put these little pop-ups in there. So just imagine as you're describing things, and as we said, some things may be more complex, but putting it in your consent, right, is going to take up a lot of space. And you think, well, maybe some people know this and some people don't. You can now have a pop-up. So you have a word that's describing something that now can have this pop-up that gives a definition of that. I'm trying to think of a good word that maybe randomization is a good one. So you had randomization in your consent and you hover over that and it says, this is like a flip of a coin kind of thing. And you can change what that is, whatever term, like you have your term and then you put the language in there. So this is a new thing that got added and I'm very excited. I haven't used it yet. So if anybody has or is going to, let me know, because I'm trying to think obviously how I could do this. We've wanted this for forever and now I'm like, need to kind of figure out how I can do it. All right. All right. So, how to convert paper consent to e-consent. So I find for myself, the easiest thing for me to do with my consent is to write up my consent, how I want it, and be like, yep, that has everything in it. And then I'm going to go into the design from the e-consent component, right? Because the first part is just having the language. The second part is putting it in there electronically. Like I said before, what you don't want to do is just kind of take that document and just plop it into, I mean, you can, but it doesn't make it, I think the concept of having an e-consent makes it better and easier for participants to understand it. So design it in a way that people can understand it. And that is by breaking it up, because you can make it into separate pages. You could put questions in there if you wanted to kind of make sure they understand the concept that you're doing. You could, because it's in the survey concept, you could ask them a question that says, what does randomization mean? And then you can have them answer something. And if they get it wrong, you can be like, no, randomization means this. Do you have to do that? No, but you could. So this is all the wonderful things that you can kind of do with it. Can a visual help with this a little bit better? So you saw pictures, right? When you're trying to explain to, I think adults as much as kids, about drawing blood, how much blood are we taking? If you show them, we always put in like, we're taking a tablespoon of blood, right? Or 5 mLs, which is about a tablespoon or whatever. You can tell that's not my area, but it's much easier to show people, right, what that means. So if I show a little kid, here's what we're talking about, this little bit, they're like, oh, that's it? That's not a lot of blood, right? Picture is worth 1,000 words. It's much easier. Can you have a figure? You're going to do this, 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 and this. So maybe it's just a picture that shows step 1, step 2, step 3, step 4. We have so many things now within that's available to us through either Adobe Creative Suites, like like stock photos and stuff like that that you can have or you can create. Take advantage of it. You can put that all on your consent. So, and then I always, you know, I kind of talked about the receive, like what they should get, a copy of it, but confirm if they're saying yes or no to taking part. Because sometimes what I see in consents is people will have the consent and then they'll have the signature. And if things get kind of funny, it doesn't work out. You want to confirm. So what we'll do is we'll have the consent and then we'll say, do you want to take part in this study? Yes or no? And they have to indicate one or the other. If they indicate no, you thank them and say, we appreciate it. We usually ask, is there a reason? Because if you're emailing people consents, and you don't get a response back from them, you're going to keep emailing them, or you might have it set up to keep emailing them. They might just want to say, stop, I read it, I'm not interested, right? And that's how they can kind of have that out. But you also want to have the end that, yes, they understood why they were signing the consent, because you're not there to kind of do that. The other thing, and I'm trying to remember if I have this in the next slide or not, is the concept of a witness signature on the e-consent. Like, you're not required to have a witness that person signed that e-consent. So that's why you won't see that on there. Assents are different because an assent is, you have a parent and a child, and so you have to go through that a different way. So a lot of times we don't do those electronically, although we did do that for a study, like usually with teenagers or stuff like that. But with younger kids, it's a little harder unless you're doing it in person. So let's see. Little pitfalls to be aware of. Signature issues. So you have somebody do an e-consent and you're like, okay, you do this ahead of time. We're going to meet with you. What we find sometimes is you go to look at the consent before the person comes in or does any study procedures, because sometimes you go and look because it looks like it's complete. It shows that it's complete and everything. And you look at the signature and either the signature is not there or it's just maybe a little bit of a mark or a dot or something like that. And so you're like, what do I do with this? Right? So you want to know that before you do because it's different, right? If you start doing study procedures and you feel like you don't have a signature on the consent correctly, now you have to contact the IRB and say, hey, I have this participant, we did study procedures, I thought they completed the consent, but here's what I have. And so that's a reportable issue, right? Versus you looked at it ahead of time and you noticed that there was something wrong with it. So you worked with the participant to see what you can get. Now, Chris and I were talking about what entails a signature, what could be allowable. And it's really what that person does. So just because you can't read their name, I look at my signature, it looks like a B with a blah, like nobody probably thinks that's, a signature, but I don't write anymore. So that's become my signature. So I think as long as it looks like a signature. I think Alexander said that you can type your name in for a signature. You know, I hadn't thought about that. That might, if the IRB allows that, that might be actually better. If it's allowable, you can have them type their name and have their signature, or some kind of signature, but something to think about in your process. Can the person consent for themselves? So what kind of population are you working with? Is there a chance that the people might be illiterate? Is there a chance that the person might have dementia or some other kind of issue? Now, there's always a chance, right, if you're dealing with the general population that you fall into this, but are you particularly looking for older adults where you're going to have a higher proportion of people might fall in that category, then you may want to have a plan set up for how you deal with that for confirming that that person is able to sign for themselves. So it may be that it's like, oh, we need somebody who's their legal authorized representative to do that. How are we going about getting that? And so there's going to be a different way that you're going to design that from there. We talked about emailing. If you're missing a consent, this has happened before. I don't know, every once in a while, right, something weird happens and you're like, what happened to that consent? You know, what are we gonna do with that? A perfect example of this is a couple years ago, Alexander and I were like doing something where the person signed the consent on the iPad with this person for one of my research assistants, and the consent was gone. We couldn't find it or whatever. And I think we determined that it was, you can't be logged in and then have like logged into the iPad under your account and then also having somebody sign the consent in this other thing, because one overwrote the other one. The signed being logged in overwrote the other one, which wasn't. So you got to kind of think about that a little bit. Don't have two instances open, I think is really probably the key. If you're going to be consenting, have it in that survey and open it up that way versus being in the signed in version of it, if you can. Are there other things that people have come across before we go into 21 CFR Part 11 compliance? Yes, Jess. Oh,
So I've run into a problem where a participant will go through the e-consent part, then they'll get to the part where they have to confirm that they've written everything down, and they close the window because
Oh.
it doesn't, they don't realize looking at it that they need to scroll down and confirm everything. And then, not very often, but it's happened at least twice, we've had someone want to check on their consent form, so they click on the link again. Because they never confirmed it, they lost it because they opened up a new instance of that.
Oh, okay. Yeah. So what did you do to fix those two instances?
Yeah, so I think we had to just get rid of the sample we collected on those two
Oh,
and then have
okay.
them re-sign the consent.
Okay.
But we've been thinking about using the PDF snapshot and having it trigger and collect a snapshot if it has like the signature boxes filled and the form is saved in with anything. I don't know if that would work or not. That was just kind of what we were thinking.
What do you think, Alexander? You're the expert.
Yes, that definitely sounds like a great idea. That should definitely work. Of course, it's not giving you necessarily that's sense of that verification process being completed. It's not giving you that kind of assurance, but it's certainly a way to at least maintain that data and works in a pinch. And then the one or two other things that come to mind are just education in terms of that first page at the bottom of the survey page, descriptive text field, big font, bright colors saying, when you click submit, don't close the tab. This is not the end of the survey. You do need to view this PDF and verify. But yeah, that's what comes to mind. I want to say there was something else, but if I think of it, I'll let you know.
Hi, I just wanted to say that we've encountered that issue as well. And so one of the things we've done is just what you were describing at the bottom of the consent page. We'll have a descriptive text box and then put an action tag on it, like to hide it from the PDF or the consent thing when they actually print it out. But it says, you put in big, bright, bold letters, make it real big, saying, you must continue to the next page, scroll down and click submit. It would be nice if we had a little bit of control over the confirmation page,
Oh,
the text that displays there. I think
Yeah.
that's something that has often come up, and my colleagues have asked for that. I'm like, I thought we don't have that capability, but that might be a good suggestion.
Yeah, agreed. Yeah, when you kind of get to that, that's the part with the e-signature that's kind of built in there, and then it kind of gets a little confusing for folks because of that.
We
so.
do a lot of neurodegenerative stuff too,
Mhm.
so it can be really confusing to people. They think they finished it, they did the signature, and so then they'll go to the next page and never actually hit that submit.
Yeah, I think it's confusing to most people, even without having some, neurodegenerative
Adds
disease.
to
So,
the issue.
yeah, absolutely. Any other issues or anything? Okay, well, we're going to leave some space at the end so we can kind of just answer a bunch of questions, and I feel like talk as a group. So if you guys have those types of things, I'm going to go to Chris in case you guys were wondering what 21 CFR Part 11 was.
Good morning, everybody. I'm going to talk really briefly about 21 CFR Part 11, compliance and validation. Not going to go into depth, but you've heard people mention it, so I'm going to quickly talk about it. Part 11, it's called Part 11 because it comes from the 11th part of the FDA regulations. So if you've ever had a sponsor say, is your system Part 11 compliant? It's called that because that's what the feds call it. It applies to electronic records and signatures in research. And really, this applies to drug and device studies. So if you work on no drug and device studies, don't worry about this. Don't worry about it. If you work on some or all drug and device studies, please pay attention. And the goal of Part 11 is really to make sure that the electronic records and signatures you may collect in research are, just as solid as paper versions. So, is the electronic signature you're getting the equivalent of a handwritten signature on paper? Is the data you're directly entering into a database the same as, equivalent to the data you might be collecting by hand? It's required for electronic signatures like e-consent, but also for the PI to sign off on AEs, for example. If they're doing that electronically, it needs to be done within a Part 11 compliant system. And it also applies to direct source data entry. So if the data doesn't exist anywhere before this moment, and you want to enter it directly into a database, say you're in an exam room with a patient and they're getting a physical exam and you're, typing their blood pressure results or whatever the case is. If that source data doesn't exist anywhere else, and you're directly entering it into the database, that database needs to be Part 11 compliant. So if it's being entered into Cerner first, and you're taking it from Cerner, Cerner's the source, and it's Part 11 compliant. So that's fine. But if you're skipping that medical record step, that direct data entry is what this applies to. So I've already sort of covered this. When is a Part 11 validated system necessary? When you have an FDA regulated study, which means a drug or device or biologic study, and you're using electronic signatures or direct data entry. So if you're working on a drug study and you're not using electronic signatures, you're not doing direct data entry, then you're fine. But if you're working on a study that's not FDA regulated and you're using eConsent and REDCap, for example, that's also fine. But just, yeah, I'm here to tell you a bit about, what you need to have in place. And there's no one size fits all. Again, just to talk about FDA regulated studies, some folks conflate FDA regulated with, does it have an IND or IDE? That is a subset of the big FDA regulated universe. So that's not really the question to ask, although IND studies definitely are FDA regulated. Really, it's the study of any drug, device, or biologic, where at least one objective of the research is related to getting data about that product. So not FDA regulated studies are observational studies, behavioral studies that are not using a drug or device. And really, if you ever wonder, is my trial FDA regulated or not? You can look at your IRB application. There's an FDA section there. So depending on how you answered that, should tell you. And if you still can't figure it out, please ask the IRB. They have told me to tell you, go ask the IRB if you have any questions. So don't feel like you need to guess or become an expert in making this decision. Just go to the IRB, they can help you. A question we get a lot is, can I use REDCap for my FDA regulated study? And the answer is, okay, well, I think that's the next slide. But I'll tell you, REDCap at IU's instance of REDCap is not validated for Part 11 yet. We are looking into what it would take to make that happen here. But for now, the answer is we can't use REDCap in those ways I talked about for FDA regulated studies at IU yet. And the reason is Part 11 requires validated system. First off, but it also requires lots and lots of SOPs that are kind of centrally managed and lots of controls about access within a system and ensuring specific training about the use. So we need a system, we need documentation, we need training documented for everyone specifically to use those features, which we don't yet have here. So we're, trying to wrap our arms around what that looks like. Currently, there are some options here. If you have FDA regulated studies and you want to use an eConsent feature or you want to do direct data entry, there are Advara systems that are administered through the Office of Clinical Research that are Part 11 validated and available. So for now, that is the option until hopefully we'll share some good news in the future about other options. So if REDCap is not validated for Part 11 at IU yet, can I use it? And the answer is it depends, right? So some folks here, it's not Part 11 validated, I can't use REDCap at all. That's not really the answer. If you're collecting data anywhere else before you directly enter it into a database, so if it's in Cerner first or you're writing it down on paper first, and then you're entering it into the database in REDCap, that's fine. It's that direct data entry part that is not an option yet. And we can't use REDCap for eConsent for these studies yet, but the Advara system is an option. All right, there's my info if you want to give a question later and want to follow up. But now we have the Q&A portion.
Are there any questions? And if you are in Zoom land, please type your question in the chat and Jim or I will make sure that it gets answered.
So I'm sure a lot of you came in here for maybe like you're thinking about this, you're already designing it or a particular question. Feel free to throw it out there. Don't be shy. Yep. Sure.
That question was just to put the information back on the screen. Thank you.
Absolutely. That was an easy one. Yes.
Hang on one second, I'm coming.
So for the studies that need the Part 11, so for the FDA-related ones, if you have most of your data collected on paper first and then input it, that part's fine. But I'm curious about if you have surveys that are sent directly to the subject for them to take, and that's initially where the data is entering from. Is that okay?
Sadly, no. That is not, yeah, that's not okay yet. But that's one major feature that the Advara systems don't have yet. They're also working on that. So we know that's a need, whether it's in REDCap or Advara, we know that's a need from a lot of study teams that people want to fill out electronic surveys. We understand. So yeah, great question. Thank you for asking. And I'm sorry, I don't have good news yet.
That's fine. Thank you.
We have a question in chat. Does IU REDCap have a pre-made template based off our current IRB template for consents?
I want to say no. I think you have to put it in there. And I would say because I don't love the template that we currently have at IU from a participant standpoint. I think it's more of a guideline kind of component. Here's the key things that you need to put in there. So have we designed a template for that? No. But it's really to kind of help you through that. When we were talking earlier about the signature part and do you do that? I would probably put everything in the signature on its own page so that I'm walking people through so that I know that I've gotten it. And then also that whoever's collecting that checks it. Not that it's just done, but that there's actually a signature there before they're doing any study procedures. That's another aside, but sorry. So the question was, do we have a template set up specifically based on the IU template? And I would say no. Other questions? Okay, we can talk a little bit about like some things that we've run into. I have Fatma here. Fatma, you might have to turn that on. Or you can come up here, whatever you want.
Just like a general thing, I think we've
Yeah.
covered all the main components that I've run into. I think the most important thing is making sure that you have the signature before you do anything with the participant or collecting the sample. That's where I've seen the most frenzy.
Yeah, and that's usually where like, at least for like, if you're doing sample collection, it's like, oh darn, now we're gonna have to throw out the sample. So, other types of things. I think the other thing to think about is your whole process, your consent process. If you're bringing a person in or you're sending it to them, you know, have that as like, what is your structure for that process? So I'm going to talk to a person. I'm going to say, yep, is it okay to send this to you? And they say yes. And then you're going to email it to them. And then you're going to get it back. And so what I'm going to do, I'm going to check it before that person comes in. What if the person's coming in to give a biospecimen? Have I checked it prior? So make sure that's all part of your process with, you know, ahead of time. So think about those things. You're always going to run into those issues. So what is your backup plan to that? What's my backup plan if I'm going to get I sent them the email and they didn't complete it and they're coming in at 1? Is it then to try to get the consent online? Or is it that I'm going to have a tablet there? Or can we also accept a paper version? Now, some studies will be like, no, we only wanted an electronic version, so it has to be signed on the tablet. So what's my process for that? Do I have enough time before they go into that visit to kind of do that? So you just want to kind of have your little caveats along that way to kind of think through that process. If you're doing kids, you know, what can we do with kids? What's allowable to kind of do? Like I showed you what we actually just printed those up, but we could have it on a tablet for somebody. Kids are very, you know, tech savvy, right? So we could set that up so they could easily flip through that and read it, and they would totally understand that much better. In fact, we found the adults liked it just as much to kind of have it explained. So sometimes simpler is better. So you want to think about those types of things. You could even embed, just so you guys know, a video. So if you wanted, like the biobank actually did a 3-minute video. So if you have a nice little video, or you even have maybe the PI talking a little bit about your study, why it's important. That could be your important part right there. Is like just 30 seconds. Here's why we're doing this study. And that's your intro to your consent. Sometimes that kind of helps people a little bit more. They understand it a little bit more, puts a face with the person. And so you want to think about that. I would also say too, for the translations, don't just think like we're going to translate this into Spanish and that means the same thing or whatever language, because it doesn't kind of convert that way. I think people make that assumption. I think AI has gotten really good with this. It's gotten better, but there still are words that are totally different. And so you want to make sure that somebody who's native speaking can kind of look at that and go, is that really what you meant? So that you can kind of get a concept of whether that kind of translates appropriately. Okay, yes.
What does it look like to like prep or download these eConsents for like auditing at the end of the month? Can you like
Oh,
mass download them like for the month, or is it like individual files?
it's individual files, unfortunately. I don't think there's a way to mass download them. I want to go ahead, Alexander, if you. Okay.
Right now it's on. So in general, that is the case. There is an option. So if you select the option to save those PDFs to a file upload field, there is an option to download a zip file of all of the file uploads in the entire project. But that's going to give you, all of the file uploads. So if you have some other non-related files that are being uploaded, you're going to get those as well. And that gives you everything at once. So there's not a sort of, you can select particular records to batch download. But it's something.
Yeah.
We have another question in chat.
Yeah.
Has anybody had a survey to confirm the patient understands what they are signing before the signature page? Just a few questions to hit the main points, and how have they worked with this?
I have not. I've heard of other people doing it, but I haven't done it myself. Chris, have you? Yeah. Chris was saying basically that other people have done it, but she hasn't. But I think it's good. Now, if you talk to the bioethics people who did do this, well, actually what we did is for the biobank is we did the consent, we had them sign this, and then later on, so it's not quite the same thing, but later on asked them, did you understand these things within the consent? And what they found is majority of the people didn't understand the entire concept of the consent, but then bioethics was like, well, at what point do you decide if they want to consent? Like, do they have to pass some kind of test for them to participate? Is that what you're looking for? And I think what you've seen elsewhere is that people are like, for other, I'm using biobanks. It seems like this is where they've used it the most. Is that what they will do is not be like you have to pass this test, but that if somebody got the answer wrong, they would say, let's say this is going to take place, you're going to be over for 3 months. And if somebody says, how long do you think this study is going to take place? And they say a week, and it says, sorry, the answer actually is that this study will take place in 3 months. So they might reiterate what the information is versus using it as a way to, sorry, you didn't pass, so we're not going to consent you into that study. So there may be things out there, and we can kind of look and kind of share with the group on that, of other ways that people have done. I'm sure there's other people within REDCap who've done it. You can definitely do it within there. I would just, advise you to kind of think about it as an education component versus a pass or fail kind of component for it. So
Let's thank our panel. Thank you very much.
thanks, everyone.